We're going to demonstrate for you now the squat exercise. This is a whole body exercise that aims to increase the strength and control of the major muscle groups around your back and your lower limbs. This exercise relies on the individual strength of your core muscles, your buttock muscles, your quads, hamstrings and calves to give you the ability to perform this exercise with the right control and alignment. Now, weakness to these individual muscles can reduce your control and actually lead to more stresses and strains being placed on the joints and soft tissues of your back, hips, knees and ankles. This can ultimately lead to pain. And you may find it difficult then to perform simple functional tasks like standing from a seated position, climbing stairs, and even more higher level tasks like running and jumping. It's vital that we're able to perform this exercise with the correct technique. This will ensure that you are working the correct muscles, and therefore this will ensure that you're getting the right protection for the joints and soft tissues, and therefore reducing your pain. So we're going to go through these techniques now. So Pete, I'd like you to stand with your feet shoulder width apart, your knees facing forward and on a stable surface. Okay Pete, simultaneously I'd like you to push your hips and bottom back behind you, bend your knees like you're sitting down and raise your arms out in front. Good. Come back up for me and perform that again. So push your hips back, bend your knees and raise your arms out in front. As you can see, this is allowing Pete to maintain good alignment of his back and alignment of his lower limbs. This is really important because there are some major faults with this exercise. The first fault is actually bending too much through the back when you perform this exercise. So as you can see now, Pete is really arching around the back, and this is putting an extra strain in this area and can lead to injury. Now this can be due to a few reasons. It can be due to poor technique or poor activation of your core muscles. You may want to refer to the core activation exercises to see if this improves things. Now, another way of improving the technique, Pete, is to really overemphasize bringing your arms out in front of you as you lower your bottom behind you. Can you do that again for me, Pete? So as you can see, as he stretches his arms up, it keeps his back nice and straight and takes the load off the back. The other major faults are around the knee. The first one is that the knees come too far past the toes when you squat down. Now this can be due to poor glute control, and also it can be due to poor activation of your core. The second major fault around the knee is that the knee rolls in and almost touches together. Again, this can be due to poor glute control, but also it can be down to tight calf muscles. So you may want to refer to our core activation exercises, our glute strengthening exercises like the bridging exercise, and the calf stretches to see if this can help. Now, to improve the technique with this, we're going to use a bed or a chair, and the height of this needs to come up to around the midpoint of your thigh. So Pete stood in front of the bed there. What I'd like you to do, Pete, to try and really activate the glutes, I'd like you to squeeze them throughout this contraction and really emphasize aiming your bottom and hips back towards the bed. I'd like you to touch down on the bed but not put your full weight on it, and then stand yourself back up. Can you just perform the exercise again, please? Great. So you squeeze in the glutes to keep the knees in alignment and squeeze the glutes to straighten you back up. This glute activation and the fact that he's pushing his hips backwards will reduce that inward rotation of the knees and also reduce your knees coming too far past your toes. Now, if you are unable to correct these techniques with these tips, you may want to try using a mirror in front of you to guide you. And still, if you're not able to correct the techniques, you really must consult your physiotherapist. We recommend that you gradually build up to a maximum of 30 repetitions, taking regular breaks when you feel you need to. Alternatively, listen to the instructions given to you by your physiotherapist. Now, Pete, it's normal to feel muscle ache around the back, the glutes and the legs, but what we don't want is for this to increase your pain by more than 2 out of 10, with 0 being no pain and 10 the worst pain imaginable.